HIV and AIDS, a diagnosis many feared hearing. Today, specialists involved with the Opt-in for Life program are here to share with us the status of HIV and how their program is making a difference in central Pennsylvania. Also today, you'll meet one patient who has been living with HIV since the 90s.
I'm an old lady. I'm 55 and I've been living with this, not dying, living with this for almost 17 years. Well, actually 23.
You'll see how she has not let this diagnosis stop her from enjoying life. And happening right now, specialists from Opt-in for Life are here in our studio taking your questions during a live web chat. To ask your questions, visit abc27.com/chat. Good afternoon. Thank you for being with us. Today we're bringing you a special edition of Good Day PA. I'm Amy Kem. First, we do have a news and weather update for you. Flora Pastorero is in the ABC 27 newsroom. Hi, Flora.
Hi, Amy. Some are upset over the president's comments on the deadly attack in Virginia. They're now calling on Congressman Lloyd Smucker to respond. There are protests outside his Lancaster County office. They feel the congressman has not done enough to stand up to the president. That's why they want Smucker to unendorse the president. After the president's remarks, Smucker tweeted, "Those who march under Nazi flags or with KKK-affiliated groups are not fine people." More local school districts reacting to Monday's solar eclipse. Looking directly at the sun can cause severe vision problems. Special glasses are strongly recommended. Schools want to keep students safe. Cumberland Valley students will be kept indoors Monday for recess, and Chambersburg and Greencastle Antrim school districts have canceled classes on Monday. Well, tonight's next chance for you to try to become a millionaire. The Powerball lottery jackpot now stands at $430 million. The drawing tonight at 11. You do need to buy your tickets before 9:59 p.m. The odds of winning, 300 million to 1. Now for an update on the forecast, here's ABC 27 meteorologist Brett Thackara.
Hi, everybody. Later on today, expect hazy sunshine and really humid conditions. A good day to lay by the pool here as summer dwindles. It is going to be nice and dry today, 87 degrees. Pleasant evening on the way to take a walk, but it will be muggy. Just be aware of that. Meteorologist Eric Finkenbeiter will have the latest on some storms coming later this weekend. He'll have the exclusive eclipse forecast, too. That's coming your way tonight. In the meantime, let's send things back to Good Day PA.
Awareness campaigns to stop the spread of HIV have existed since the 1980s. In 1988, World AIDS Day, which is December 1st, became the first ever Global Health Day. Let's look at some current facts about HIV. According to the CDC, someone living in Pennsylvania has a 1 in 115 chance of being diagnosed with HIV at some point in their life. The good news is, in the United States, the annual number of new HIV diagnoses declined by 9% from 2010 to 2014. Now, joining us now, we welcome Dr. John Zerlo, an infectious disease specialist at Penn State Hershey Medical Center, and also Rebecca Geiser, the program manager at the Pinnacle Health REACH program. We're going to answer some questions here on the set today. So, Dr. Zerlo, first, can you start with a brief history of HIV, when this began, who was infected?
Yeah, HIV really came on the scene in the early 1980s, and really throughout the early 1980s through the early 90s, we saw groups of people, particularly gay men and injection drug users, really struggling with the disease until we really developed treatment in the mid-1990s. And the treatment has really revolutionized the treatment of HIV, and people do extremely well. But on the other hand, I think it's really out of the public eye now in many ways that people really feel it's kind of a solved problem, and therefore we see, though a decline in HIV, we're seeing still too many infections.
So that's sort of where we are right now at this point. Rebecca, let's talk about HIV, how it's impacted the LGBTQ community here in the Harrisburg area.
Harrisburg is an interesting place because we're a small city surrounded by rural and suburban communities, and that's different than Philadelphia, a large city. So people can feel marginalized, stigmatized, and if you add HIV on top of that, it can be particularly challenging. But on the flip side, people have additional resources in a caring provider offering non-judgmental treatment in central Pennsylvania, which is what Opt-in is all about, connecting people to those non-judgmental providers where they can get treatment.
Yeah, let's elaborate on that. You mentioned Opt-in. I mean, that's the reason we're here today. So explain what this campaign is.
Sure, we have two parts to the campaign. First, We are trying to promote health and wellness amongst people living with HIV, as well as with the wider community, promoting testing and treatment in HIV. And a new diagnosis can be really scary, but we want to say that we have treatments today where people can live long, healthy, and productive lives, so we want to connect people to those treatments. Once they're in treatment, we have a lot of good resources, including a new app where patients can download the app and help keep them connected to their care and on their medications.
Yeah, the app sounds really interesting. We're going to talk about that just a little bit later, more in depth. I mean, in your opinion, why was this program really started? I mean, you touched on this a bit, Rebecca, but why do you think this program is needed, and why was it started here?
Well, the fact is we have these great medications, and the challenge, of course, is that people just aren't connected to care. And so we have this, what we call the HIV care continuum, looking at people who are not diagnosed, not in care, not on treatment, and therefore not controlled. The goal of this program is to bring the program to get people into all those things.
It really empowers patients, I would think, really empowers them. Thank you so much for talking with us. We're going to continue our discussion about that opt-in program a little bit later in the show, but as part of this special Good Day PA, ABC 27 and Opt-in for Life are hosting a web chat, and our Carrie Perry is here now to share some viewer questions. Hey, Carrie.
Hey, Amy, that's right. Specialists are answering questions right now, and you can go to abc27.com/chat. Joining me is Kim Snyder, and she is the Director of Case Management at Alder Health Services. How are you?
Good, how are you?
So I've got a question that already came in. The question is, I was recently diagnosed with HIV. I've been told by friends I should get a case manager. What can a case manager do to help me?
So the case managers in the area are there to make sure that you achieve viral load suppression. They're going to help you get to appointments, make sure you have insurance, they cover the meds, cover medical appointments. They can help with housing issues that you might have and the other expenses that you have that you weren't expecting due to the diagnosis.
Okay, very good. I do have another one. The second one would be, I think I should get tested for HIV, but I'm concerned about the cost and having my name linked to having an HIV test performed. What are my options?
So in the area, both Pinnacle Health, Hamilton, and Alder Health Services all offer free and confidential HIV testing, plus the support that you will need if you do come back positive.
Awesome. Thank you, Kim.
Yep.
So to submit your questions, log on right now to abc27.com/chat. Back to you, Amy.
Okay, thank you so much, Carrie. We're going to check back in on our web chat in just a bit, but coming up next, Sarah Thomas has not let her HIV diagnosis stop her from living life. Her story is coming up next on this special Good Day PA on ABC 27. Welcome back to this special Good Day PA. As we learned in our last segment, an HIV diagnosis is no longer a death sentence. Carrie Perry is back to share one patient's story. Carrie.
Yeah, thanks, Amy. Back in the early 90s, Sarah Thomas knew she was taking chances and was at risk to get HIV. Here's Sarah's story. To see Sarah Thomas, you would never know that she has been living with HIV.
I'm an old lady. You know, I'm 55, and I've been living with this, not dying, living with this for almost 17 years. Well, actually, 23.
Today, Sarah and her husband have a young adopted daughter, but her life now is far from her life a few decades ago.
Oh, good job, Mom.
23 years ago, long before her current marriage, Sarah had unprotected sex with a man she did not know was infected with HIV. It would be 2 years later that she would learn her fate. Her employer was doing a blood drive, and Sarah felt compelled to participate.
I said, this is how I'm going to get tested. And I donated. I think a person makes poor decisions when they're feeling a little crazy about something. It's commonly heard that secrets keep you sick. The secrets you keep you sick.
Sarah's secret would be outed, and she would be told of her illness in a rather blunt manner.
The Red Cross called me in, and they just sat me down, and they turned a folder around, and that was back in the days of dot matrix. And in big letters across a piece of paper, it said HIV.
Sarah would continue to keep her HIV status to herself, at the time feeling zero health effects from the disease, until the summer of 2000.
I kept getting bronchitis, bad bronchitis. And then Everyone said it was rosacea, but it was actually dermatitis, which is basically your body's poisons coming to your surface.
After a visit with her doctor, Sarah was immediately admitted to the hospital.
My T cell count was 40, and my viral load was over 2 million. Dr. Katz met me, and I said, "They say I'm dying." And she said, "You're not dying on my watch."
She came to me, newly diagnosed with an infection that, we diagnosed through our testing, and then determined that she was HIV positive. And through the 15 years I've taken care of Sarah, what we've been able to do now is streamline her medications to 1 pill a day.
When Sarah was first diagnosed, her treatment was aggressive and sometimes unmanageable.
Back then, our treatment was effective, but it consisted of multiple medications. Patients oftentimes had to take up to 20 pills a day to control the virus. And there was a lot of side effects associated with those medications. They had to take them on a rigorous schedule. So it was really consuming for the patient's life because they had to really focus on taking those medications.
Today, patients with HIV can manage their disease far better.
These medications now have minimal side effects. So the patients are able to take the medications very effectively, on time, and keep their virus under excellent control. And now they're living very normal lives.
Sarah is living a pretty normal life, but says there still is a stigma with HIV.
Well, of course you had to be crazy to get AIDS. That's how people still think. Well, you must be mentally demented if you would even risk that. Well, if he were alive, I dare anyone to ask Ryan White that.
Candy!
Still, Sarah remains open about her disease.
I don't run around with a big A in my head, and I am sure to tell people who are scared it's a life diagnosis, it's not a death sentence.
And she offers this simple advice.
Get tested. Get tested.
Well, Sarah continues to get her lab work monitored for keeping up with the disease. We'll be right back.
Welcome back to our special Good Day PA on the Opt-in for Life program. Dr. John Zerlo, an infectious disease specialist at Penn State Hershey Medical Center, and also Rebecca Geiser, the program manager with the Pinnacle Health Reach program, are here with us today. So Dr. Zerlo, tell us more about Opt-in for Life. We just heard from a patient who is successfully living with HIV. How does the Opt-in program work for other patients?
Well, Opt-in for Life is really a collaboration from all of the HIV care providers in the Harrisburg area. So my organization, Hershey Medical Center, and Rebecca's Pinnacle. We also have Alder Health that's involved, as well as Hamilton Health. What the program, what we're all involved with is the fact that we know in this HIV care continuum, diagnosis, treatment of HIV, we know that youth and young adults in particular are least likely to be in care, least likely to be on treatment.
Interesting.
And so we also know that this same group of people are very engaged in social media. They're on their phones all the time, they use mobile apps, they're in Facebook, they're in Twitter, and so we try and leverage that engagement in social media to try and improve their sort of involvement with HIV care.
So let's talk more about that app. This is really interesting. Rebecca, how does the app work? Like, what are the most beneficial features?
We've really tried to design something to give people the tools they need to get on medication and stay on medication. So they have medication reminders that they can set themselves. They have journaling where they can journal about how they feel about the medication and the treatment, and they can securely text or message with their providers, which, as Dr. Zerlo mentioned, is really convenient for them, just like they would text their friend. And it's also more secure because instead of getting a phone call from a doctor's office at an inconvenient time, they can choose when and where to access their HIV medication.
I mean, what's the feedback been for you? How have patients benefited?
They are staying connected to care. Those difficult patients to reach that are in this young age group have been now staying connected to care. One example, one young man, we were having trouble reaching by phone, having trouble having him call us back. And once he downloaded the app, he actually reached out to us to schedule an appointment for an issue he was having. So now he's coming regularly and connected after a lot of years of trying through the normal methods of phone.
Wow, that's fantastic. Really good to know. And I'm sure your patients are saying similar things.
Very much so.
Very good. Okay, well, we're going to continue this discussion again throughout the program. We're going to talk more about Opt-in for Life and the app. But just ahead, Carrie Perry is monitoring the live web chat. Let's go over to Carrie.
Thanks, Amy. Well, the specialists will be here till 1:30 today. They're answering your questions about HIV and the Opt-in for Life program on our live web chat. Just go to abc27.com/chat to submit your question. We'll share some of your questions later in the show, and we'll be right back with more of this special edition of Good Day PA.
Welcome back to the special Good Day PA on the Opt-in for Life program. We're continuing our discussions with Dr. John Zerlo with with Penn State Hershey Medical Center, and also Rebecca Geiser, the program manager at Pinnacle Health's REACH program. Let's talk more about the app, because I find this really, really interesting. How do you think it differs from just texting?
Sure. Our patients' confidentiality is really important to us, and we want to keep their privacy as much as they want us to, which is a lot. So when you just text a message a patient, you can see that maybe come up on a ribbon on their phone, and we want to make sure that that doesn't happen because they may not want that to come up. People may see it. Also, the icon is nondescript. It doesn't say HIV on it. And so it just sends a notification, and then patients can use their PIN number, an additional PIN number, to get to the message when and where they want to.
That's really interesting. Now, just because of privacy concerns, we don't actually want to show the app here on TV today, but if folks do want to download it, how do they go about doing that? Is there a fee for this app?
The app is free, but right now it's only available through the opt-in partners. So if there is a young person who is interested in getting the app to help get on medication or stay on medication, they can contact any one of the providers through the opt-in website and inquire that way.
Dr. Zerlo, I want to ask you, for folks who are watching today, do you have any advice for somebody who may be HIV, like at risk for HIV, or maybe HIV positive right now? What can you say to these folks?
I think I could say that, the reason for the whole campaign, Opt-in for Life, opportunities for prevention and treatment. We want people to get into care. Go into optinforlife.org. They can connect with our programs. They can find out where to get tested. They could find out from one of our sites where to get treated, because treatment is the key. If they get in treatment, they get on treatment, they can have a long and healthy life.
So we're talking about treatment. I also just want to ask about a cure. Do you think in the near future there could be a cure for HIV and AIDS?
Yeah, that's been a challenge because we can't cure it right now, though we can keep it under control really indefinitely for years and decades. I think we are moving in that direction. We have to find a way to finally eliminate those little bits of virus that still remain in people, even who are fully controlled. I think we've made a lot of strides. I'm sure that in my career, and therefore in most of my patients' lives, that we will reach that point. I'm very optimistic.
That's very encouraging. Very good. Ending on a positive note, our discussion today. Thank you both for being with us today. Up next on Good Day PA, we're going to have more from our viewers and our specialists participating in today's ABC 27 Opt-in for Life web chat. Remember, the chat is happening now. It continues until 1:30. We'll be right back. As today's ABC 27 Opt-in for Life web chat continues, we check back in with Carrie Perry.
Hey there, Amy. Well, we are here with Stephanie Fisher, an HIV medical case manager at the Pinnacle Health REACH program.
Yes.
Thanks for being here today.
Thank you for having me.
So I do have another question here I want to get to, and that is this. I'm dating someone who is HIV positive but undetectable. If I were to have unprotected sex with him, am I at risk to get the virus? And if I got pregnant, would the baby get HIV?
Okay, so somebody that's undetectable when they have HIV is very less likely to transmit the virus. However, it's still possible. You want to have protected sex, use condoms, or get on PrEP therapy. If you do become positive yourself with HIV and you get pregnant, you want to get to your doctor and talk to them as soon as possible, because it doesn't necessarily mean that your baby then will test positive when they're born.
Gotcha. Okay, I have another one. Last year, my labs were HIV positive. I'm concerned about the cost of medication, and since I haven't had any symptoms, I haven't pursued it. Are there ways to get the cost of medication covered?
Yes. First of all, you might not have symptoms right away when you're positive. So if you know that you're positive, get to the doctor and get on medications. Second of all, in Pennsylvania, thankfully, there are a lot of programs that cover the cost of HIV medication, so nobody should have to go without meds.
Thank you so much, Stephanie. And thank you to the viewers at home who had the questions come in. Back to you, Amy.
Okay, thank you so much, Carrie. Thanks to everyone at the Opt-in for Life program for today's special, and to Sarah Thomas for sharing her story with us. This reminder, the conversation does continue online. The web chat will run until 1:30 at abc27.com/chat. You still have time to get your answers in. Thank you so much, everyone. Make it a good day, PA.